where they looked at 25 to 29 weekers. They compared them with surfactant sufficient in term infants, and they looked at the alveolar surfactant amount in preterm infants between 25 to 29 weeks who got surfactant and who didn't get surfactant, and they looked at several time points up to, I think, about 2 weeks of age. And it's very clear that infants who get surfactant, obviously their surfactant levels match the ones at term, but the infants who don't get surfactant, by the age day 3, their alveolar surfactant or their intrinsic surfactant production then becomes more of a function of postnatal age than the postmenstrual age. So the babies can, and we all know that when we give surfactant, 1 dose is enough. So I think the big question comes is, can you sustain the baby during that period, and how effective? And there is a lot of data now emerging that even few mechanical breaths in the delivery room, intubation, the process of putting in a tube, that's why Lisa and MIST have been around, that all these are big components for development of chronic lung disease. So if you can expand the lung physiologically and keep it open with CPAP, there's probably nothing better, because that's what you're trying to do with the intubation. Surfactant, yes, it's a separate issue, and if the lung is not sufficient, and it's been shown that some of these babies, particularly the ones who fail, they need surfactant, and I wish we could identify these babies much earlier. In our cohort, we have looked at, and I'm showing you some of the data, which are the variables which are associated with surfactant failure, and you can see the success is in green, the failures are in blue. So if you are less than 26 weeks, you're less than 800 grams, you needed positive pressure ventilation in the delivery room, or your DO2 gradient is more than 180. I think the biggest one is the severe RDS on the initial chest X-ray. That's the baby you need to watch very closely. That's the one who's going to, if you don't have anything, and I think if you are, obviously if you're starting with a CPAP therapy initially, and that's what we recommend, I think the units should develop their own strategy. Many people start off, using this approach in first with a little bigger infants, more than 1,000. When they get good with the CPAP use, then they lower. And the results have been replicated at so many places. We've looked at this data again. Individually, if you see, we have looked at other things, like this is a different cohort, less than 1,000 grams here. And if you look at the overall incidence of chronic lung disease, it's 9.6% at Columbia. And if you look at comparable Vaughan institutes, it's more than 50%. And none of the factors such as intrapartum antibiotics, GBS, less than 26, severe RDS, individually, other than the severe RDS on X-ray, has a predictive value of 81. But when you look at the cumulative, you take severe RDS on the chest X-ray in a 26-weeker who has a bad pH of less than this, high oxygen requirement, and then you can see you can increase. I think it is, that's why I think CPAP is, particularly bubble nasal CPAP, it's not just science, it is an art. So it's a combination of science and art, and unfortunately, we cannot do a comparative trial at Columbia to show that it's superior, but I'm sure someone at some stage will be able to. So I don't think so we are there. People are trying to look at things like, looking at the gastric aspirates for lamellar bodies and basing surfactant or insure for those babies, which can be quickly done, but I don't think so we are there. The aerosolized surfactant delivered via CPAP, we thought that was going to be great. We participated in that trial for the smaller babies. And my experience with the device which we used was not that very good, because it seemed that all the aerosol was coming out of the mouth and very minimal probably reached the baby. I haven't seen the results of that study, but I think that would be the effective way, not to touch the airway at all, and yet find a way of delivering CPAP, the surfactant. So I'm pretty sure we will see. We've come a long way, and we will see that soon.